Okay, time for questions and answers. So let's do the questions and answers. I am so sorry to all my YouTube subscribers that I cannot get to it that often. It's just so busy, but I'll try my best. And I really appreciate you following and asking questions, leaving comments, being interactive. And the goal is to just get more and more people involved in terms of potential patients, surgeons, which are either attendings or students or interns, whatever, and just anybody who's curious. So now let's start. On one video, it's titled Nostril Narrowing Alarplasty from Bangladesh. Somebody asked, do you have experience of also reducing the width of columella? If one wants to have alarplasty but feels that the columella will look too wide afterwards, can you reduce both the ala and the columella? Tricky question. So yes, so let me just point it out quickly so you understand. So these are the ala and this is the columella. So the width reducing in the center right here is very difficult to almost impossible. At the bottom all the way right here, which is the base, yes you can. That's where you can put a through and through stitch and narrow it, and that can be done. But you cannot cut anything out. For the base, you can go from the inside of the nose, take some extra tissue out, and then stitch it and narrow it. Absolutely, that can be done. That might even translate a little bit into the upper part, but overall, like you think, like I can just cut it out. No, not happening. Okay, so that's the answer to that question. On the video, cheek augmentation on a male. The question is, Dr. Janjua, why you have used thin sheet of implant instead of thick silicone implant? Actually, it is a silicone implant. It looks thin, but it's not. It's pretty thick, actually. It's just a curve makes it look like it's a thin slice. Will this thin implant hold all the facial muscles and soft tissue in place for a longer time? Oh yeah, for a lifetime. Once it settles down, it's underneath there. Everything is above it because you are in a deep, deep pocket. You're good to go. Absolutely. Always try to do a little less with cheek implants. Trust me, it ends up looking bad if you overdo it. And also the risk of complications goes higher as well with a big one. On to the next one. African alarplasty from Albany. Is this done without cartilage? Yes. So when you do the alarplasty here, there's really no cartilage in it. It's just kind of like flesh, some muscles, some thick sebaceous glands. So that's what it is. No cartilage. Let's move on to the next one. The video is alarplasty revision on Asian female. And the question is, her bridge looks higher. Anything added to the bridge? I had to go back and look at that video, and you know what I found? The angle that I'm taking the picture is different in before and after, and that's making it look like something was added to the bridge. So nothing was added. That tells you how tricky it is with the photographs, where just a little change in angle can change everything. So very good example and great observation. So, but no, nothing was added, just that stupid angle got changed. Facial fat grafting on the cheeks. Question is fantastic. How much does this procedure cost? I'm extremely interested. Yes, I am not sure of the exact cost because I have a sliding scale. Depending on the area we are doing, small area to a large area, it could go anywhere, between, I would say, like 1,500 to 15,000. I hate to give you a range, but my prices are a sliding scale. They're not really fixed. And besides, I don't like to discuss prices myself because I can't keep it straight. My surgical coordinator usually does that, but I felt obligated to at least give some answer. This is on the video, facelift on Pakistani woman. The question is, wow, any chance of more follow-ups, please? The answer is, I would love to, but the patient actually, I think, has gone back to Pakistan. And also she's very shy as well, so when she comes for the next follow-up, I'm going to ask her if she can allow me to take pictures, maybe not the full face, just a little bit lower half, maybe, if she's okay, and I can show you the afterwards. So I will try my best. On the video, nasal bump shaving part 2. The question is, sir, how much time required for alarplasty? Like, in how much time you're done with? So alarplasty, the preparation and everything combined takes about an hour. Once I start, like I make my first incision, it takes me about 20 minutes, roughly. But there's a lot of preparation. I'd like to go slow, and the measuring takes a long time. Measuring. The actual cutting part, if you're referring to that, it's only 20 minutes. So, with the whole process combined, 1 hour. I'm surprised you asked about alarplasty in the video nasal bump shaving. In case you misspoke, then for the nasal bump shaving also it's very quick, like half hour. not that long. I mean, I'm talking about the small bumps that you'll be doing in the office, not a real hump. Not a bump, not a hump. Okay. Now the last video is complicated scar revision on the face part 2. And the question is, sir, what about laser treatment? One. Second, why not use a W-plasty in the cheek? Okay, so laser, yes, but laser is not going to do enough. If a scar is wide, it's raised and stuff, it does, but not enough. After the surgical part has been done, then laser, absolutely, starting like 3 to 4 weeks afterwards, 3 to 5 sessions, 1 month apart, it's a must. Second question was W-plasty. I have tried W-plasty and double Z-plasties, multiple Z-plasties, and geometric broken line closure, and I just find that GBLC, geometric broken line closure, it just does such a fantastic job because it's irregular, so you really can't, eye doesn't catch it. Even with W-plasty, don't forget, there's a pattern, zig, 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 zig. It's all about patterns, so I can kind of catch on to the pattern. That's what it is. That's the reason, but I'm not against it. Okay, there's a question on my video that's, journey of plastic surgeons, rhinoplasty, and somebody asked which surgeon did mine. So it's Dr. Norman Pastoric in New York City. Norman Pastoric. He's kind of like a mentor to me. I've been learning from him for like almost 20 years. Great surgeon, great human being, very kind man. So this is a shout out to Dr. Pastoric, Norman Pastoric in New York City. Thank you. So that's it, and please keep the questions coming, and I'll try to get to them as much as I can. And thank you again for subscribing and watching. So open to suggestions.